10 hidden signs in your feet that reveal diabetes. Are your feet sending silent signals you've been ignoring? What if that tingling, dryness, or odd discoloration isn't just random? It's your body warning you about diabetes. Diabetes often creeps in quietly, and one of the first places it leaves its mark is your feet. It starts subtly, maybe a little numbness, maybe a sore that just won't heal. But these signs can be the key to catching the condition before it leads to serious complications. In this video, we're diving into 10 hidden signs in your feet that could reveal undiagnosed or poorly controlled diabetes. These aren't just random symptoms, they're your body's way of sounding the alarm. If you or someone you love is at risk, this could be one of the most important videos you watch today. Let's get into it. Number 10. Tingling or numbness. Have you ever noticed a strange tingling in your feet or felt like your toes are going numb for no clear reason? You might think it's poor circulation or just fatigue, but it could be much more serious. Tingling and numbness are actually some of the earliest signs of diabetic neuropathy, a form of nerve damage caused by prolonged high blood sugar levels. This sensation typically begins in the toes and gradually creeps upward into the feet and even the legs. At first, it may feel like a light pins and needles sensation, but over time, it can become constant, or worse, you might stop feeling anything at all. That loss of feeling can be dangerous, especially if you injure your foot and don't notice it right away. A small cut or blister can quickly turn into a major complication if left untreated. What's more, this tingling often intensifies at night, disrupting sleep and making rest uncomfortable. For some, it's just an annoying sensation, but for others, it's painful, burning, or even feels like electric shocks. The scary part? Many people ignore these symptoms, thinking they're temporary. But if you're at risk for diabetes or already managing it, these signals from your feet could be your body's urgent cry for help. Catching this early can prevent further nerve damage and help you take better control of your blood sugar. So if you're experiencing frequent tingling or numbness, especially at night, it's time to take it seriously. Number 9. Burning or sharp pain. Do your feet ever feel like they're on fire or like you're being poked with tiny needles, even when you're just sitting still? This kind of burning or sharp, stabbing pain is another red flag for diabetic nerve damage, and it can be one of the most uncomfortable symptoms to live with. When blood sugar remains elevated for long periods, it begins to damage the delicate nerves in your extremities, especially in the feet. This can lead to irritated or inflamed nerves, causing intense sensations like burning, zapping pain, or even electric shock-like jolts. For some, it might come and go randomly. For others, it's a constant, nagging discomfort that doesn't let up. What makes it worse? Poor blood sugar control. If your glucose levels stay high, the nerve damage only gets worse, and so does the pain. It can begin interfering with your sleep, your ability to walk, and even your overall mood and mental health. People often dismiss this kind of foot pain, assuming it's from standing too long, aging, or fatigue. But ignoring it means risking more severe complications, including permanent nerve damage. If you're noticing burning or sharp foot pain, especially if it's becoming more frequent or intense, it's time to talk to your doctor. With the right care and tighter glucose control, this kind of pain can be reduced, and in some cases even reversed. Your feet are trying to tell you something. Don't ignore the signal. Number 8. Cold feet even when it's warm. Ever feel like your feet are freezing, even when it's warm outside or you're wrapped in a blanket? This isn't just a random chill. Constantly cold feet can be a hidden sign of poor circulation, often caused by diabetes-related damage to blood vessels. When blood sugar levels are high over time, it can lead to narrowing and stiffening of blood vessels, especially in the legs and feet. This means less warm, oxygen-rich blood is flowing to your lower limbs. As a result, your feet may start feeling cold, tingly, or even numb, regardless of the actual temperature. You might also notice that your feet look pale or bluish, or that they take longer to warm up after being exposed to the cold. These are warning signs that your circulatory system isn't working efficiently, and in people with diabetes, this can be the beginning of more serious complications like peripheral artery disease, PAD. PAD not only makes it harder for wounds on your feet to heal, but it also increases the risk of infections, ulcers, and in severe cases, amputations. That's why cold feet shouldn't be ignored. If you frequently have icy toes or a chill that doesn't go away, don't just layer on socks, get your circulation checked. Catching this early can help prevent long-term damage and protect your feet from future problems. Number 7. Slow healing sores. Have you noticed a small cut, blister, or scrape on your foot that just won't go away? That could be more than just a minor annoyance. It might be your body waving a red flag. For people with diabetes, high blood sugar levels can slow down the natural healing process. This happens because elevated glucose can damage blood vessels and reduce circulation, meaning less oxygen and nutrients are delivered to the wound. On top of that, diabetes can weaken the immune system, making it harder for your body to fight off infection. A sore that lingers for days or even weeks, especially on your feet, is something you should never ignore. Even a small wound can turn into a serious problem, especially if you also have nerve damage and don't feel the injury right away. These slow-healing spots can easily become infected or develop into ulcers, which are deep, painful wounds that are difficult to treat. Left unchecked, they can lead to severe infections and, in extreme cases, the need for amputation. If you see any sore that isn't healing normally, whether it's a blister from new shoes or a nick from trimming your toenails, take it seriously. Keep the area clean, avoid pressure, and talk to your doctor right away. Your feet do a lot for you every day. Paying attention to how they heal can help you spot diabetes complications early and avoid major health risks down the road. Number 6. Cracked heels or dry skin. Think dry, cracked heels are just a cosmetic issue? For diabetics, it can be much more serious. Diabetes often causes nerve damage that affects your sweat glands and oil-producing glands, especially in your feet. When that happens, your skin doesn't stay naturally moisturized. The result? Dry, rough skin that can crack open, especially on the heels where there's more pressure and movement. These cracks, called fissures, may seem harmless, but they create an open door for bacteria and infection. And because many diabetics also suffer from reduced sensation in their feet, they might not even realize a crack has become inflamed or infected until it's too late. What's even more dangerous is that dry, damaged skin often goes unnoticed or untreated, especially in older adults or those with poor vision or limited mobility. If left untreated, those cracks can deepen and lead to painful infections or foot ulcers, which can spiral into serious complications. Taking care of your skin is not just about comfort, it's a critical part of diabetes management. Moisturize daily with a foot cream, but avoid between the toes. Check for any cracks or bleeding, and always wear socks and shoes to protect your feet from friction and dryness. If your heels are constantly cracked, peeling, or bleeding, it's time to pay attention. This seemingly small symptom could be a big warning sign from your body. Don't ignore it. Number 5. Changes in skin color. Have you noticed your toes looking a little off? Changes in foot color might seem minor, but they can reveal a lot about your blood sugar and circulation. If your toes or feet start turning blue or purple, it could be a sign that blood isn't flowing properly, something diabetics are especially at risk for due to damaged blood vessels. Poor circulation means your tissues aren't getting enough oxygen, and over time, this can lead to serious complications, including tissue death or ulcers. Redness, on the other hand, could indicate inflammation, infection, or increased pressure, especially around wounds, bunions, or swollen areas. In diabetics, this redness can spread quickly if not treated, sometimes signaling the early stages of cellulitis or another bacterial infection. And if your feet have taken on a yellowish tint, it might be due to glycation, where excess sugar attaches to proteins in the skin, altering its color and texture. Yellowing can also be a sign of fungal infections, which thrive in the warm, moist environment of socks and shoes, especially when circulation is poor and immune defenses are low. These subtle color shifts aren't just cosmetic, they're often your body's silent alarms. Ignoring them could lead to worsening complications. If you ever notice sudden or unexplained color changes in your feet, it's time to get them checked out. Catching these signs early can make all the difference. Number 4. Swelling in feet or ankles. Notice your shoes feeling tighter by the end of the day? Swelling in your feet or ankles, also known as edema, is a common yet often overlooked warning sign in people with diabetes. This kind of swelling can happen for several reasons. One major cause is poor circulation. When blood vessels are damaged from high blood sugar, your body has a harder time pumping blood efficiently back up from your legs. This leads to fluid pooling in the lower extremities. Another possibility? Kidney strain. Diabetes is one of the leading causes of kidney damage, and when your kidneys aren't working properly, it can't remove excess fluid from your body. That extra fluid ends up collecting in your feet and ankles, especially after standing or sitting for long periods. Swelling can affect one foot or both, and it often worsens as the day goes on. In some cases, you may also notice tight skin, shiny patches, or even indentations left by socks. While occasional swelling isn't always serious, persistent or sudden swelling could point to serious complications, including heart or kidney issues. Don't ignore it. If your feet feel puffy, heavy, or unusually tight, it's your body's way of waving a red flag. Keeping an eye on this symptom and getting it checked early can help you avoid more serious consequences down the road. Number 3. Loss of hair on toes or feet. Have you noticed the hair on your toes or feet slowly disappearing? It might not just be aging or friction from socks. In fact, this subtle change can be an early red flag of poor circulation, a common complication of diabetes. When blood vessels are damaged by high blood sugar over time, it becomes harder for your body to deliver oxygen and nutrients to your extremities. Hair follicles, especially in your feet and toes, are very sensitive to changes in blood flow. As a result, they may stop producing hair altogether. This symptom is often gradual and easy to overlook, especially since most people don't inspect their feet daily. But in the context of diabetes, even small signs like this matter. The loss of hair can indicate that your blood vessels are narrowing or hardening, early signs of peripheral arterial disease, PAD, which often goes hand in hand with diabetes. Another clue? The skin in these areas may appear pale, smooth, or shiny, showing signs of reduced nourishment. While hair loss on your feet may not seem serious on its own, when paired with other symptoms like numbness, cold feet, or slow-healing wounds, it could point to more significant vascular issues. Don't ignore it. This small detail might be your body's quiet warning that your circulation and glucose levels need urgent attention. Number 2. Foot deformities or structural changes. Have you noticed a change in the shape of your feet or toes? Maybe your arch looks flatter, or your toes seem to be curling or shifting position. These aren't just cosmetic issues. They can be serious signs of nerve and muscle damage caused by diabetes. Over time, high blood sugar levels can lead to diabetic neuropathy, which weakens the nerves that control the muscles in your feet. When these muscles become unbalanced, they can't support your bones properly. This leads to structural changes, such as claw toes, hammer toes, or a collapsed arch. One of the most severe outcomes is a condition known as Charcot foot. In its early stages, it may just look like mild swelling or redness. But as the bones in the foot become weak and fractured, it can cause the entire shape of the foot to change dramatically, sometimes even leading to joint dislocation and permanent deformity. These changes not only affect how you walk, but also increase your risk of ulcers, infections, and even amputation if left untreated. Unfortunately, many people ignore these signs until the damage is severe. If you start to notice swelling, warmth, or sudden changes in foot shape, especially if you have reduced sensation in your feet, seek medical help immediately. Catching these issues early could save your mobility and prevent long-term complications. Your feet are your foundation. Don't ignore their warnings. Number 1. Complete loss of sensation. Imagine stepping on something sharp and not feeling it at all. That's the reality for many people with advanced diabetic neuropathy. Complete loss of sensation in the feet is one of the most serious and dangerous signs of uncontrolled or long-standing diabetes. This happens when prolonged high blood sugar damages the nerves so severely that they stop sending signals altogether. You may not feel cuts, blisters, burns, pressure, or even extreme temperatures, which means injuries can go completely unnoticed. The danger lies in what happens next. A small wound you don't feel can become infected quickly, especially if blood flow is already compromised. Without proper care, it can turn into a deep ulcer or abscess. And because you don't feel pain, the infection might continue to spread before it's discovered. In the worst cases, this can lead to serious infections, gangrene, or even the need for amputation. That's why foot checks are absolutely essential if you have diabetes, especially if you've ever noticed numbness. Run your fingers along your feet each day. Look for any signs of injury, color changes, swelling, or skin damage. If you notice anything unusual, or if you can't feel light pressure or touch, contact your doctor right away. Complete numbness isn't just uncomfortable. It's a red flag that your diabetes needs closer management. Don't ignore what your feet are trying to tell you. Your feet might be quietly warning you about something serious. Don't ignore the signs. From tingling and cold sensations to slow-healing sores or complete numbness, these subtle changes can be the first red flags of diabetes or its complications. Catching these symptoms early can prevent nerve damage, infections, and even amputation. So if you've noticed any of these signs, talk to your doctor as soon as possible. A quick checkup could make all the difference. Have you experienced any of these foot symptoms? Share your story in the comments. Your experience could help someone else. And if this video opened your eyes to something important, give it a like and hit subscribe for more life-saving tips on managing diabetes and protecting your health.